Welcome to the Slop Farm. Enjoy the video.
You start by inspecting the puckered zone and surrounding tissue, palpate to locate the thread tract and any anchoring points. Once done, mark the entry and exit and explain to the patient you will gently release tension. Make sure to use antiseptic and localize any knots or barbs under gentle traction. Prepare a blunt cannula or fine forceps and 2730G needle. You'll use minimal manipulation to avoid new trauma. This focused prep sets up the controlled release step. You now reduce tension. Hold the skin steady with one hand and apply slow, opposing traction with the other to see where the thread binds. Once visualized, insert a blunt cannula along the tract to bluntly dissect adhesions or use fine forceps to tease loops free. This minimizes tearing. If a visible trapped segment is irreducible, make a tiny, controlled cut to release only that portion. Throughout, reassess symmetry and avoid excessive force to prevent new puckers. You finish by irrigating the area with saline, smoothing the tissue with gentle massage, and reassessing contour from multiple angles. Make sure to apply light compression and a sterile dressing. Counsel the patient to limit facial movement for 24 to 48 hours and avoid heat or vigorous massage. If puckering persists despite release, escalate. Consider enzymatic dissolution where appropriate or refer to a senior clinician for thread removal. If inflammation or atypical pain appears, stop and evaluate for infection.
Thanks for watching. Consider subscribing if we helped you today.